All right. Well, as a few more people are still trickling in, I'll go ahead and get started. Hello to all of you who are here and welcome. I'm Rebecca Hansen, the Senior Director of Communications here at the Center on the Developing Child. And we are delighted to have you all join us for today's webinar, How Air Quality Affects Early Childhood Development and Health. The center recently published a working paper on this topic from one of our scientific councils, the Early Childhood Scientific Council on Equity and the Environment. And today's discussion will be grounded in much of the science presented in that paper. So we'll walk through some of the many ways that air quality impacts young children and their caregivers, particularly indoor air quality, and we'll offer strategies and solutions for taking action in your own community. We'll share a link to the working paper and some related publications in the chat right now, and you can keep an eye on the chat throughout today's webinar for other relevant resources. We also want to thank those of you who submitted questions for our panel when registering for this event. We received, as always, so many great questions, many of which we'll address throughout today's conversation. And we're also hoping that you will take a quick minute to share your feedback about today's discussion in a brief survey at the end, and I'll be back on to share that before we conclude. If you're interested in listening to this webinar in Spanish, we also have a Spanish language channel, and instructions for joining this channel are posted in the chat. We have live closed captioning enabled as well, so if you're interested in that functionality, you can turn it on at this time. So without further ado, I will quickly introduce our wonderful panel for today. Our moderator is Dr. Lindsey Burghardt, Chief Science Officer here at the Center on the Developing Child and a practicing pediatrician in the Boston area. She is joined today by Dr. Joseph Allen and Dr. Alison Lee, both of whom were authors on the recent paper. Dr. Allen is an associate professor at the Harvard T.H. Chan School of Public Health, director of Harvard's Healthy Buildings program, and co-author of Healthy Buildings: How Indoor Spaces Can Make You Sick or Keep You Well. Dr. Lee is an associate professor of medicine with tenure and associate division chief in the Division of Pulmonary, Critical Care, and Sleep Medicine in the Department of Medicine at the Icahn School of Medicine at Mount Sinai. Dr. Lee also holds joint appointments in the departments of pediatrics and global health. So again, we're very excited to have all of you with us today. And with that, I will turn it over to Lindsey to begin our discussion.
Thanks, Rebecca, and thanks to everybody who took the time to be with us today. I'm just going to give a brief introduction and overview of our topic, and then we'll jump right into talking with our panelists, who are two of my just favorite scientists to talk about with anything, but especially this topic. I've learned so much from both of them, and I think it's really going to be a good conversation. So until really recently, the reduction of the outdoor air pollution in the US was a pretty great success story, and I think it was maybe one that we didn't talk about enough. There was a Clean Air Act in 1970. There were big updates in 1977 and again in 1990 in response to some new data. But that act really reduced outdoor air pollution from a wide variety of sources by more than 70%. And it was pretty amazing because it saved trillions of dollars in healthcare costs. And that happened even as our population, the economy, the number of cars on the road were all growing. And through about 2020, the act was actually estimated, based on what the research tells us, to have prevented, and I think this is kind of amazing, almost 2.5 million days of worsened asthma symptoms, 120,000 emergency room visits that didn't happen, more than 5 million lost school days that would have occurred, 200,000 heart attacks, and more than 230,000 premature deaths. But more recently, wildfire smoke that's been fueled by excessive heat and drought, all brought on by climate change, has actually increased some types of air pollutants. And unfortunately, this has caused a deterioration in the outdoor air quality in nearly 3/4 of the contiguous United States. So it's really critical that as we're here today, we think about addressing these trends and talking about new policies and new solutions and thinking about what really strategies do we need to meet this moment. When we do that, I think we also really need to expand our focus. So, not just thinking about outdoor air quality, but our focus today is really thinking about the air quality that we breathe indoors. Because although we focus for a long time on outdoor air quality, most of us as adults actually spend more than 90% of our time inside. We're enclosed in our homes, in buildings, in vehicles. And during pregnancy, in the first few years of life, it's probably actually even more time than that. Think about where kids are spending their time. It's childcare facilities, schools, community centers, summer camp buildings, offices, homes, cars. So I'm really excited to talk with Joe and Allison today because they're two experts who have different backgrounds, but I think will bring really complementary expertise to the conversation. So I'd love to start by Joe, we'll start with you. If you can just briefly introduce your work and your background in air quality research.
Yeah, so thanks. First, it's so nice to be here with you. Thanks, Rebecca. Thanks, Lindsay. I'm a professor at the Harvard School of Public Health, and I run what I call Harvard's Healthy Buildings program. And I got into it precisely for the reason that Lindsay mentioned is that we're an indoor species. We don't like to think of ourselves that way, but we do spend the vast, vast majority of our time indoors. But if you think about what the public or any of us think about when we think about health, we think about we have to eat healthy, exercise, all good and important, shouldn't smoke, really important. But very few people think about the indoor air they're breathing all the time. Certainly, in schools, offices, homes, cars, airplanes. And it has this massive impact on our health. So the way I got into this, actually, before I joined Harvard, I was doing forensic investigations of sick buildings. So because we don't always pay attention to indoor air quality, people get sick in buildings a lot. I get calls every single week from schools, people in their homes worried about an issue in their building. This was my career for a long time, chasing so-called sick buildings. Sometimes a cancer cluster, sometimes a disease cluster in kids in a school. Sometimes it was an environmental exposure that led to Bell's palsy. So I saw too much of this, and what I saw in the practice was that it never took all that much to turn these sick buildings into healthy buildings. Usually didn't cost much. Usually was a relatively simple fix. So when I came to Harvard and joined the faculty there, I created the Healthy Buildings program, and our mission is to improve the lives of people everywhere, every day through better buildings.
Yeah, that's great. I learned so much from your work too. Allie, can you do the same? Can you introduce yourself for us and just share how your clinical work and your research is related to what we're talking about today?
Yeah, great. Thank you. And again, thank you, Dr. Burghardt, and everyone else for the opportunity to speak to this audience about air quality, which is such a critical and important topic. And as Dr. Allen mentioned, I believe there's so many opportunities, as we'll hopefully discuss, to improve the health of all children. So as was mentioned, I'm a physician, I'm a pulmonologist by training, a scientist, and also a parent of 3 young children, one of whom has asthma. And so the topic of air pollution, especially air pollution within the homes, is really important to me on a personal level as well. So clinically, pulmonologists take care of patients that have lung disease, for example, asthma or other breathing problems. And my research focuses on understanding how environmental exposures during both the prenatal and early childhood periods really shape health, not only over childhood, but really over the life course. So not only asthma risk in childhood, but also chronic lung disease risk throughout the entire life course. I'm really committed to thinking about how we can work with community members, community leaders, policymakers to use this science to influence public health. And that's why I'm really excited to be here today with all of you to discuss this working paper that was recently published around air pollution and childhood health. So thank you so much.
Yeah, thanks, Allison. You guys were both just so critically helpful in putting that paper together. And Joe, in the paper that we published, I think I learned this from you that the EPA says that actually levels of indoor air pollutants can actually be 2 to 5 times higher than what they are outdoors, which I think for many of us is really surprising to hear. So can you share with the audience first, how are outdoor and indoor air related? And then what are the most common sources of that indoor air pollution that our audience should know about?
Yeah, so it's a surprising stat for a lot of people. The way I think about it and wrote about it in my book is I think of there are like these 3 assaults that are happening. And the first is what's happening inside our building. So that's where the pollutants are 2, 5, even 10 times higher than outdoors. And that's from all the stuff we use indoors. Cleaners that emit things like volatile organic compounds or VOCs, gases that can be toxic, things that emit from gas stoves. We have pet allergens. We have chemicals that come out of our furniture. So there's this buildup of pollutants indoors. And the problem is that about 40 years ago, we started to design our buildings to be kind of these boxes that are choked off the air supply. So you can imagine if you're in a tight little box with a lot of sources inside that are releasing and the building's not breathing, well, you get a buildup of those hazards. That's the first like indoor assault. The other one's really important, and few people think about this, but outdoor air pollution penetrates indoors. Things like wildfire smoke or pollutants from automobiles, that's outdoor and the levels are high. They will penetrate in our homes and offices and schools. And because we spend 90% of our time indoors and most of your breaths happen indoors, it turns out that most of the outdoor air pollution you breathe happens inside. That's probably new to a lot of people. Thinking about outdoor air pollution that way is an indoor hazard. So you have indoor sources, you have outdoor sources that come in. And the third one I talk about is really what your neighbors are doing. And if you're in a multifamily apartment building, it turns out that up to 30% of the air in your apartment could be from the air from your neighbors. So whatever they're doing, so people, I've lived in apartments, right? If your neighbor's cooking, you can smell it sometimes. So you can imagine that means there's a flow, and that means anything in that apartment can come into your building, whether it be viruses, bacteria, or chemicals. So I think about it that way. You have your indoor sources you control in your space sometimes. Our buildings don't really allow our buildings to breathe and dilute that. You have outdoor pollutants coming in, and then you have what your neighbors are doing that can also contribute to poor indoor air quality in your space.
So would it be fair to say too, then, if you were to clean indoor air in a space like an apartment, that could have beneficial effects for everyone, right? Like if we can clean everybody's air and that air is circulating from space to space, you're not just benefiting one person, you're benefiting by sort of decreasing pollution throughout the building.
No doubt. Exactly right. Yeah. And there are things to do to improve your space and your neighbor's space. That's good. Good think about it.
So, Allison, in the paper, we really highlight there's a number of ways, probably too many for us to get into today, about all the different kind of pathways through which indoor air pollution has really powerful effects during the prenatal period and the first few years of life. And I know this is your expertise with your research as well. If you had to choose, like, which of these do you think is really the most compelling and the most important for our audience who are, early care providers, people working in early education? Which one should they know about? Which of these effects?
Yeah. Well, I mean, thanks for that question. I would start out by saying that pregnancy and early childhood are just such critical and amazing periods of development, right? So over the 40 weeks of pregnancy, we essentially go from a couple cells to a developed, multiple organ system functioning baby. I mean, the amount of development, rapid development with these intricate and interconnected organ systems that's occurring over pregnancy, I think if you think of it that way, then you begin to understand how any sort of toxic exposure, and we just heard from Dr. Allen about these exposures within the home, how any sort of toxic exposure during that time period could impact development and then influence how healthy the baby is after the baby is born. And development doesn't just stop at birth. We know that over childhood, children are continuing to grow and develop. And so those exposures, again, over early childhood will have a critical impact on many different organ systems. And so I know you asked me to pick a few, but I will say that there is extensive and really consistent scientific evidence that air pollution exposure, again, during the prenatal and early childhood periods, can negatively impact health. So, for example, we can think about higher exposures increasing the risk for preterm birth, increasing the risk for low birth weight, lower lung function, increased risk for asthma, brain development, and worsening cardiovascular health. Essentially, every organ system can be affected. But I do want to point out that we also know from many studies that effective public health policy that reduces air pollution exposure can actually improve health. So not only do we have science that says that air pollution can harm us, but we also have science that says that policies and that there are opportunities to then improve health, which I think is critical. And then finally, just the last point that I want to make about sort of the importance of these periods is that our bodies are incredibly plastic. So in other words, even if we're exposed to higher levels of air pollution exposure, for example, over pregnancy, children who are exposed to higher levels of air pollution will still benefit from lower air pollution exposures over early childhood because the body, as I said, is continuing to grow and develop. And for example, with lung function, we can see accelerated lung function growth in childhood with lower air pollution exposures. So I think it's critical that, not only do we understand the health impacts of air pollution exposure, but also that we understand that it's never too late to intervene and that cleaner air is always beneficial, even and potentially especially for children who may have been more highly exposed in the past.
Yeah. So I love how you said that too. It's sort of like there's this two sides of the same coin. I think like we're all sensitive to environments, but prenatal development sort of evolves in a way that makes these biological systems really especially sensitive to these environmental exposures. So these negative influences that can happen during this time can have this outsized negative effect on outcomes in adulthood. But then the converse is also true. I think is what I'm hearing you say, that if you protect people early and there's things that we know that work, you actually get also this outsized positive effect on all of the outcomes that we care about. So you can prevent heart disease, you can prevent neurodegenerative disease, things that a lot of different people care about actually by intervening and protecting people early when these systems are most sensitive.
Yeah. And I would say it's always more effective public health policy to prevent the onset of disease than to treat disease once it has developed, right? So if we can think about ways that we can reduce air pollution exposure so that the air is cleaner and healthier and our children are healthier, that's going to be a lot more effective in the long run.
Yeah. And I love that sense that it's never too late, right? Yeah. So, Joe, in the paper and in the in brief, we talk about some of these more common pollutants in the air. Some of the ones you taught me about are formaldehyde, VOCs, which I think we can define in a little more depth for our audience, and black carbon, particulate matter. So, can you talk a little bit more about what these pollutants are and really how exposure to these types of things can affect development, particularly during pregnancy?
Yeah. So I think maybe the best way to think about it conceptually before you get into the formaldehyde and benzene and specific chemicals is, I would think about it as particles and gases, right? So if you think about outdoor air pollution, when it's smoky out, that's mostly particles. There are gases in there. And then you have the gases, which we call in our field VOCs, volatile organic compounds. And that's things like you may have heard about, like benzene and formaldehyde, but it's also the scents and scented cleaners and things like this, and other chemicals that are off gas or used in dry cleaning materials. This is a wide group of chemicals, these VOCs, but ultimately it's particles and gases that we're exposed to that emit from products, sometimes outdoor products being the automobile or coal-fired power plant that can come inside, or from indoor products and sources, things that come off of our couches or cleaners and things like that. So Dr. Lee mentioned a lot of the different, health impacts on the well-established links between exposure indoors even, and things like lung function. So maybe I'll just pick up that and just build on one in particular, which is the impact of these chemicals, formaldehyde, benzene, both carcinogens, by the way, and black carbon and these particulates. So we know there's a lot of evidence showing that all of these can impact brain function. So even my own work has linked and found links between VOCs and particle levels and higher order cognitive function. So basically decision-making performance is linked with these particles and chemical exposures at levels we're all kind of exposed to all the time at varying levels. There are also many studies linking outdoor air pollution with brain impacts at all different age levels and influence not just on cognitive functioning, but also things like anxiety, depression, suicide ideation in kids. And then as adults, Alzheimer's, Parkinson's, other depressive symptoms and neurodevelopmental impacts. So you start to see through this combination of particles and gases that are toxic, and it's a complex mix depending on what's in the home, office, or school, but influencing that's just one system, both your decision-making performance, but also your overall well-being and mental health, all linked back to these chemicals like formaldehyde that has sources in the home. Black carbon comes from outdoor pollution, but they're all mixing in the home and they're leading to these many outcomes, influencing every organ system. But I just pulled out a couple from the brain to highlight that and the richness of data just on that one topic alone.
Wow. Yeah, it's a lot. But I think we're going to get into some of the solutions because there are really actionable things that you can do to decrease your exposure to these things in your indoor air environment. So Allie, we talked in our paper in a separate brief about the effects of wildfire smoke on kids. And I know it's a little bit of a shift from these other more common indoor air pollutants, but I think it's important to think about because we talked, at the beginning that it's really driving a lot of the changes that we're seeing in our air quality. So what do you think are some of the most important effects of wildfire smoke exposure on kids that people should know about?
Yeah, well, I mean, wildfire exposure or ambient air pollution or exposures within the home are just tied to so many health impacts in children. Um, I want to, I've done work in Hawaii with a group that's studying survivors from the Maui wildfires. I think not only are there the direct impacts from exposures, such as reductions in lung function, increase in respiratory symptoms, longer term health impacts that I think yet we don't fully know the longer term health impacts of, such as on within that population on neurocognitive development. But I think the other really important point is that for communities that are impacted by wildfire exposure, there's a lot of stress and trauma exposures that's also directly related to health. And so you get not only the air pollution exposure, but the stress and trauma exposure. And I think thinking about sort of those together and in combination is also critically important when thinking about health.
Yeah, I'm so glad you said that because I think at our center and in the work of our council too, we try to talk a lot about how interconnected all these influences are. Kids aren't just experiencing wildfire smoke, or they're not just experiencing exposure to off gassing from VOCs or extreme heat or stress, but they're all really interconnected in the developmental environment. So none of these things are acting alone.
Right.
And I think, it's important to, when we go out and advocate and communicate, that it's the interaction of these influences from the built and natural environment with what's happening in a child's environment are relationships, which we put a lot of focus on, rightly so, for a long time. But each of these things on their own activate pathways like inflammation, right? So if you have a stressful experience in your home as a child, even if it's within your social environment, and then you have a stressful experience like wildfire smoke, a spike in your inflammatory response is going to be greater when you experience these two things together, than when you experience them alone. So, Allie, do you think that there's maybe this is a good tie into some of your asthma work? Like, are there specific health outcomes related to asthma that are influenced by like these more interconnected exposures of stress and pollution?
Yeah, so I sort of love this framing, right? That you don't experience air pollution in isolation, but rather it's one of probably multiple exposures. And we know from the scientific literature that those stressors, for example, psychosocial stress, even, maternal stress over pregnancy is associated with worse childhood outcomes. So for example, in our own work, we've found that higher moms that report higher stress in pregnancy, that their children are more likely to develop asthma in early childhood as compared to those who have lower reported stress. And as you said, a lot of these pathways are very similar. Oxidative stress, inflammation, epigenetic changes are likely at the root of those health effects. And so what we see then is we can look at people who are not only exposed to stress, but stress and air pollution exposure. And in fact, we've done this and we've identified that moms who have higher air pollution exposure and also higher stress, that their children are more likely to develop asthma. Now, I will say, I think it's really important to think about resiliency and the flip side as well, because what we also see is that moms who report lower stress over pregnancy, that the effect of air pollution is actually lessened. And so again, we can think about ways, resiliency factors that we can try to build on to reduce the health effects of air pollution. And so again, we've seen this with stress. We've also seen it with nutritional intake. So we mentioned oxidative stress as a major pathway. So moms who have better antioxidant intake over pregnancy have lower effects of air pollution exposure on some biomarkers that we've looked at. And so again, I think it's really complicated and can get complicated, but I think the bottom point here is that we can think about not only how these multiple factors may amplify the harm effects, but I think it's important that we also try to identify other opportunities for intervention. And again, thinking about reducing stress or thinking about improving diet, other factors that may improve health outcomes is critically important.
Yeah, that actually raises a question for me. And before I ask, because it's one I want to ask you both, I just want to define for our audience too. We've used a term a couple of times, epigenetics. And so just making sure we're starting from a common ground. When we say epigenetics, we're really talking about how environmental influences, things like the pollutants that we're talking about, can actually affect the expression of your genes. And this can happen in a number of ways throughout the body. You can actually begin very early with epigenetic changes that happen in places like the placenta in response to exposures like the ones that we're talking about today. So, your question about, resiliency and building solutions, maybe, Joe, I'll go to you for this first, but Allison, I'd love to hear your thoughts as well. Why do you think, especially because when we think about these compounding exposures and the way that they're happening together, stress and pollution exposure, why do you think it's so important? And how can we think about really multidisciplinary collaboration when we're stepping in and thinking about how do we reduce exposures across so many different spaces? Like you pointed out the complexity of it. And I think the flip side of that too is that maybe there's a lot of other people that we can bring to the table besides those of us who think of ourselves as early childhood people when we're stepping in to help kids.
Yeah. So, well, I congratulate you all because I think that's what you do here at this center. I mean, just by virtue of this conversation, right? So, I would love to add on to this conversation. We know there are unequal outcomes. We know what drives a lot of this. And I'll just tie into the buildings piece. So, we know there are wide disparities in terms of building quality that feed into this. So, not just areas that are lower income being exposed to more outdoor air pollution, but also the quality of the buildings aren't as good. And I'll give you some specific examples. We know that people are lower income, and due to issues of racism, we know that populations that are in these areas are more likely to be Black or Hispanic, and they have an older housing stock, which is more likely to have lead, which is one of the most neurotoxic metals we know in terms of kids' neurodevelopment, right? It leads to IQ loss. So you have not only the outdoor pollution is different, and we have disparities there, but actually the quality of the housing is different. And then not only that, we see that in places, for example, like schools or even community care centers have even lower levels of ventilation. So I talked about like the choking off the air supply. So in some of these worse designed structures, it's even worse. You have pollutants inside, and there's even less ability for that space to breathe. So it gets into that interdisciplinary question of like, how do we think about the social factors that are influencing people's health? That also we see differences in the built environment factors. So that's my domain. And then the environmental factors and all of the complex factors that put people in these places in the first place that lead to these differences in health outcomes. So I think it's critical. Otherwise, we're not connecting the dots here between health, built environment, social structures, and how they're all influencing health together.
Yeah. Allison, what would you add to that?
Yeah, that's fantastic. And
Yeah.
I completely agree. We need multidisciplinary teams, which again, I think the center does such a great job of bringing groups together to achieve that goal. We need to not only be sort of studying the problem from a researcher or health perspective, but really involving communities, community members, community leaders to try to develop sustainable and community-specific solutions. We need to be thinking about who on the policy side do we need to get in the room to understand what the data gaps are, to be able to push health protective policy forward. We need health economists, right? We need people in the room who can say that policy makes sense, is like an economically feasible policy that makes sense. And then I think, also thinking about who has a lot of contact with kids, teachers, people in the schools, right? Working to make sure that we're identifying potential sources within the schools, thinking about innovative solutions, healthcare providers to educate our patients. A lot of people think that the indoor space is a clean space, right? And we need to change that. And perhaps we start changing that by thinking about educational programs in the schools, in the healthcare centers, and at the community level.
Yeah, I think that's terrific. And if we had to think, I'd like to ask each of you this as well. Maybe Joe, will start with you. If you had to go in and start with like these practical solutions of what people can do, we have a lot of people listening in who are spending time in early childhood settings.
Yeah.
So thinking about those, and then also individual homes and healthcare environments. And Joe, maybe when you answer, you can speak to, I threw out the problem of wildfire smoke earlier, but not necessarily any solutions. So maybe we can talk about, this answer broadly, but then also maybe some specific things that people can think about as that season sort of is upon us.
Yeah, so this is my favorite part because I've been talking a lot about the problem, but really there are really good solutions here. So I think in terms of the wildfires, and this is good advice, I think just generally, we put out some guidance related to the LA wildfires. We did some of the response in Maui too, and I think there are three ways I'd think about how you're going to control indoor air quality. Number one is you want to clean the air, right? So that's some simple things. You want to have good ventilation. So you have higher ventilation rates than you want to make that box breathe a bit more. So higher ventilation rates. You want to upgrade your level of filtration. So again, think of those particles flying through the air. The filters are what's capturing those. You want to upgrade to what we call the MERV 13 filter, MERV 13, a MERV 13 filter. Most homes have a MERV 8 filter. And most schools, maybe even less than that. And that might capture 20% of those particles. A MERV 13 gets you to closer to 80 or 90%. You can also supplement that with use of portable air cleaners or portable air purifiers, are sometimes called. And those typically have a HEPA filter. And if you size them right, we have some tools on our website to help you size them. You can do a pretty good job of cleaning that indoor air. So that's number one, is cleaning the air. Number two is you want to control the dust. A lot of these pollutants we're talking about that are asthmagens build up in the dust. And as we kind of walk around our homes or schools, we kick that up and we have little dust clouds around us, like the old Peanuts character Pigpen, right? That's actually what's happening. We've studied this. You see little particle clouds around us. So you want to control the dust. That's basics of good, vacuuming. If you can have a vacuum with a HEPA filter, that's even better. So control the dust, kick off your shoes when you walk in your home, things like that. Third thing is you can monitor and measure this. The advancements in air quality monitors have been rapid, and that means the costs have dropped significantly. So it used to be prohibitively expensive to measure things like particles and VOCs indoors, but you can do that now with lower cost air quality monitors. We do this at Harvard, and it's a good way to keep the pulse of what's happening in your building. You'll know if your strategies are working or not. I think those are really important. Last thing I'll mention, which should come first, is source control. So there it's better product selection, low VOC paints, limit the amount of things you can do that use VOCs and off gas into the home, no candles inside, that releases particles, things like that. We have some tips on our website for what you can do for a healthier home. You want to run your exhaust over your stove when you're cooking. That actually brings pollutants out while you're cooking out of the house. So there's a couple other things you want to do, but it all starts with, I think, good source control. And then you want to clean the air, make sure you're controlling the dust, and then monitor and measure.
That's terrific. And Allison, anything you would add, especially with regards to like the healthcare environment?
Well, actually, if I could just add on one quick thing, I think it's fantastic to think about all the things that we can do in our own home or in schools. But I think we do need to remember, as we previously discussed, that there are disparities in the communities that are exposed and in the households that are exposed. And oftentimes, the communities that are more highly exposed are lower income communities that may not be able to afford a lot of interventions. And so I do think like a critical piece of, improving indoor air quality, as Dr. Allen mentioned previously, right? Like outdoor air is a really important source of indoor air quality. And so we know in the United States, and Dr. Burghardt, as you started us off in this session, the Clean Air Act, we have decades of experience demonstrating that effective policy can actually clean up the air we breathe and make it healthier. And there's a large body of scientific evidence to back this up. And so I just want to highlight a couple studies that I think are really pertinent to children's health. So for example, there's a Southern California Children's Health Study, and that showed that due to public health policy, that there was a decline in air pollution exposure, and children who grew up with cleaner, healthier air actually had better lung function growth. They had less asthma. They've had better neurodevelopment. I mean, all the outcomes that we've spoken about. In other words, when you clean up the environment, your children are healthier. So I think that's critically important. You can see this on the short term as well, right? So we know, for example, during the Atlanta Summer Olympics in 1996, the Olympic Committee required that there was a reduction in air pollution to protect the health of the athletes. But actually, studies at that time showed that there was also a reduction in asthma attacks in children. So just a real world implication of the fact that policies, effective public health policies to improve air quality, can protect children's health. And we know that outdoor air quality, greatly influences indoor air quality as well. And I think just to, your question before about sort of different partnerships, I think that's another area where we can think about different interventions with regards to indoor sources of air pollution. And this is one where I think you could look to Libby, Montana as a really great example of sort of a community and government partnership. And there in Libby, Montana, a lot of the households were heating their homes in the winter using wood stoves. And it was identified that that was a major source of air pollution exposure, both within the homes and also outside in the communities. And so there was a large sort of partnership, both on the local, state, and federal level, to basically change out or replace over 1,000 older wood burning stoves with newer EPA certified wood stoves. And they've basically demonstrated a sustained reduction in air pollution exposures, both inside the homes and outside, and critically, significant reductions in reported childhood wheezing and respiratory infections. So I just want to really highlight that we do have, a lot of evidence that these partnerships and policy can really improve air quality and improve health. And I think that that's an important focus for us as we move forward.
And I love that example too, because I think there's, especially in communities that are more affected by lower socioeconomic status or poverty, that it's really hard to make the upfront investment if you're a family to replace your wood burning stove. And so it takes the partnership to have that upfront investment, to be able to partner with communities who can identify what the needs are and then actually implement it with overcoming those cost barriers. So to both of you, if we're thinking about these multiplier effects, like the stresses of poverty, the effects, Joe, you talked about the effects of racism, even thinking about violence, like you had to name, what should the policy priorities be if we want to address some of these intersecting sources of risk? Maybe Joe, you can go first and then we'll go to Allison.
Sure. I think, I think we have to get to the point where there's not a healthy buildings program at Harvard or anywhere. It just should be the norm. We design buildings the right way, right? I want to be put out of business. And I don't think it's all that hard to do. I think I'd start with just basics of air quality, ventilation, and filtration. The reality is, starting in the 70s, like I said, we designed our buildings too tight. I'll put some numbers on it. A typical school is designed for 3 air changes per hour. That means the amount of air inside the space is changing roughly 3 times an hour, roughly every 20 minutes. Some nuance there, but that's how you can think about it. Typical home gets half an air change per hour. But if we stick with schools, they're designed for 3, but then we forget about time. We forget about them over time and it slips. So most schools, even if they're designed for 3, get 1.5 air changes. In schools that are predominantly Black or Hispanic or lower income, it's sometimes down at 1 air change per hour. We've been recommending at least 4 to 6 air changes per hour. California just adopted this for their schools. So when we think about, all these conversations we're having, how do we just make healthy spaces for everybody? We can start by changing our building codes and standards such that we're not just having these minimally acceptable levels. We need to use health-based targets. The standard that governs air quality in every building everyone spends their time is called the Standard for Acceptable Indoor Air Quality. That's the crux of the problem. It's not the standard for healthy indoor air quality. So how do we go to standards for healthy indoor quality that just get built into every home, every apartment, every school, every office, every car, bus, airplane? We haven't had health as the North Star when it comes to how we design and operate our buildings. That's the crux of the problem. I think we start to fix that. We change the mindset and just say, hey, we have to build these buildings with better ventilation, better filtration. That will go a long way. At the same time, one other thing, we do have work at Harvard that others are now adopting on better. We have a Healthy Materials Academy. So at Harvard, we have 50 big projects where we've now selected products without these toxic chemicals. So there are ways to also address the sources, improve the building and the envelope and ventilation filtration, choose healthier materials. And our studies have shown when we do that, objectively, we have better indoor air quality, lower levels of these particles, and lower levels of the toxic chemicals in the air and dust, all for not that much extra cost cost, if any? It really doesn't have to be all that complicated. Anyway, that's how I think about policy and where we need to go to control the sources, but also how our buildings are designed and operated.
And I thought a lot in the past about how sort of like heat and temperature, contributes to gaps and racial achievement gaps in education. But what you're describing with the ventilation rate, I mean, it would make a lot of sense that that would also be a contributor, right? If you're in a school where the exchange rate for the air is much lower, that's going to affect your ability to think and learn. And
That's
that's
totally tied in. It's totally tied in. We've been writing about indoor heat waves. So
Yeah.
think about it when you have an outdoor heat wave, a lot of your building, depending on how it's designed, in the Northeast, our buildings are designed to retain heat because predominantly we were or are a cold weather area. But now these buildings are absorbing that heat. And even after the outdoor heat wave subsides, the building is still cooking. All of those materials can be re-releasing that heat. So you can have an indoor heat wave that lasts beyond the outdoor heat wave. And how does this impact kids? There's a really big study looking many years in New York State, over 10,000 kids, looking at their test scores. And it turns out if you took a test on one of these extreme hot days, you were more than 10%, you had a 10% greater likelihood of failing that exam. So you can link these things. We're talking about air pollution, but you're right. It's about heat stress. And again, the building is playing a key role. Is it keeping it a comfortable and safe environment, or are you exacerbating it, creating these indoor heat waves? And sure enough, of course, it influences kids, and we see it on things even like test scores. So I'm glad you brought that in. It's definitely all related.
Yeah, and the teachers too, especially teachers who may be pregnant and spending time in these environments. So, Allison, anything you'd add with the policy priorities? What should we really be focusing on?
Yeah, I love everything Dr. Allen just said and support everything. And I think the other thing I would think about is to sort of add on to designing healthy buildings is designing healthy communities, right? So as we're building schools, building daycare centers, perhaps thinking about where they're being sited and making sure that they're further away from major roadways, not near power plants, making sure that we have clean air surrounding those schools. I think that would be critically important. And then I think also, again, we've spoken about education, but I think within the healthcare setting as well, we really need to think about developing health-based regulatory standards that can be, applied and considered in the clinical context. As a pulmonologist throughout our training, we don't really think about indoor air quality. I mean, maybe for asthma, we'll ask someone, do you have carpets in your home? Is there mold? But we're not asking about air pollution exposures within the home. And so I think we need to educate our healthcare professionals to really start to incorporate air quality and other environmental hazards into the clinical flow and develop standardized educational, patient-facing materials so that not only are we educating the healthcare providers, but we're also educating our patients who may be more susceptible to the effects of air pollution exposure.
Yeah, and then can be empowered to make informed decisions about the behavior that they can control. And I think a lot of times I kind of go into webinar conversations and I get very like energized by all the things I want to do to like push on the policy realm to like make all these changes. So if people are listening, maybe Allison first and then Joe, like if you're an early childhood professional and you're listening in and you say, yes, like I want to advocate for these policies to happen and for these regulations to be in place and for these standards to be required, like what are actionable steps that people can take?
Yeah, so I think, advocacy is critical, right? So I think once we're educated to understand the problem, we need to think about ways that we can use that knowledge to influence and make our communities healthier. And so we can think about this as sort of rippling outward and, almost like when you throw a pebble in the water and that ripple moves out. We can think about that within our homes or within our families, within our local communities. How can we advocate within our communities? To let our local officials know that we care about this, to let our schools know that we think it's important that our schools have a healthy indoor environment for our children. And then again, sort of having that ripple effect go out so that you're thinking about on the state and on the federal level. And I just want to point out, I think we're at a really critical period right now, thinking about federal policy around the environment. We do need a strong environmental protection agency that is willing to enact and enforce regulations to protect the health of our communities, not only from harmful air pollution, but water pollution and other toxic exposures. And we're at a really critical junction now where the EPA has proposed a number of rollbacks of existing policies that have been substantially vetted and have a lot of very strong scientific evidence underlying them. And so again, I think as we're all educated around the importance of environment and air pollution on health, we really need to take a step back and think about how we can use our voice to advocate for our communities. And I think right now, especially, that includes on the federal level.
Thank you. Joe, anything you'd add there?
Yeah, I love all those. I'll add just
Yeah.
a couple others that I think, that are some specific things related to the building. I think everyone should be advocating that their schools adopt this 5 air change per hour target that we set during COVID through the Lancet COVID-19 Commission. I chaired a task force on safe schools and safe workplaces. CDC adopted it and California just adopted it. There's a target out there. The current minimum standard, not around health, is 3 air changes. Go for 5. I think that's immediate. I think some of the other things out there, if we think about these kind of healthier materials, we have a healthy materials playbook. We just wrote about it in Harvard Business Review. It applies to businesses, similarly offices and homes. And I think it's a simple 2-step playbook that people can follow. The first is demand transparency about what you're buying. We don't get ingredient labels on the products we put into our homes or schools. So we think the first step is just transparency. Next time you buy something, ask for the ingredient label for the product. That will go a long way. Second, and this is in the playbook, then look to avoid these known toxic chemicals. There are things out there like a red list of chemicals to avoid. We say we don't purchase any products at Harvard anymore with forever chemicals or PFAS or some of these toxic flame retardant chemicals. So I think we can think about it that way. Let's advocate for better ventilation filtration. We can do this in schools right now. There's a playbook out there. And then on healthy material selection, there's also a playbook out there where we just have to demand to know what we're buying. That seems obvious and fair and reasonable. And 2, we want to say we don't want any of the known harmful chemicals in the products we're buying for our homes and schools. So I would offer those as 2 actionable items.
Joe, I didn't plan this, but I referred to your book this morning, and I'm just going to hold it because you mentioned a lot of good resources, but I think if you want to learn more about what we're talking about, it just is a really nice breakdown for people who don't study chemicals for a living. I thought it would be very dense, and they're really these ideas of a playbook, like 5 things you can do in these different spaces, I think is really helpful. And the audio version from the library even is just really helpful in breaking down in different settings, what can we do today, and then what we can advocate for on these bigger kind of levels with policies and with regulations. So we had a lot of great questions, as always, that our audience submitted in advance, and I think we have time for just a few of them today. Allie, I think I'll go to you first. You mentioned, we talked about this a little bit in the beginning of our conversation, but if we can delve into some more detail, there was a lot of interest in understanding how air pollution drives increasing mental health disorders that we're seeing among our kids, as well as sort of different neurodevelopmental outcomes. So people are really interested in things like attention and autism spectrum disorders.
Yeah, so I think, and Dr. Allen mentioned a lot of this earlier, I think it's really critical to understand again that air pollution is not just affecting the lungs when we breathe it in, but in fact that it can be absorbed into the bloodstream and really travel longer distances in the body to affect things like the brain. And so that's just a critical point, that it's not only the lungs, but it's really all these other organ systems. How does it happen? I mean, it can have a direct impact on the brain and on development. We can also think about those pathways that we talked about: oxidative stress, inflammation, epigenetic changes as well, as potential pathways to driving changes in neurodevelopment. So I think there's many different pathways. Dr. Allen, I'll pass it over to you. I know you're also an expert and you've done a lot of work in this area, if you want to elaborate on specifics.
Yeah, I think just some of the, some of the new science around these particle exposures and outdoor air pollution, again, which is indoor air pollution, looks at the particles that actually, and so you think about how they're reaching the other parts of the body. So the lungs is obvious, right? We breathe these in. You mentioned, great, we absorb them. They pass around our body through the blood. But also, some of these particles are small enough that we inhale them, and through a direct passage into the brain from the nose, they actually bypass the blood-brain barrier. So, and we see evidence of this. So there's another mechanism where it's like direct action of these particles directly on the brain, despite and in addition, systemic influence, which we know outdoor pollution and indoor pollution is associated with increased risk of cardiovascular disease or heart disease. Another one I think I'll mention related to these developmental effects is we haven't talked so much about these, but these are the other toxic chemicals that are in products like these flame retardant chemicals or forever chemicals that we know interfere with the hormone system. And there we know they influence and impact thyroid hormone, which is key, as you both know better than me, certainly, but that's critical for neurodevelopment of kids. So there's a couple different mechanisms by which all these different pollutants we're talking about, some that are outdoors, some indoors, are influencing the body and brain health through a couple different mechanisms, through hormones, direct action on the brain, systemic action through the body. So it is really multi-organ, and not surprisingly, if you look at all of the epidemiological evidence, we see it in all of this. We see links between air pollution, both indoor and outdoor, and all of these health endpoints. And conceptually and logically and mechanistically, it makes sense. The puzzle, we understand how the pieces of the puzzle fit.
Mm-hmm. And so, since we have people from a lot of different backgrounds listening in too, I want to dive deeper for a second. And when we talk about the blood-brain barrier, I think we're really talking about this barrier that lines and protects the brain. And you can think about it, I think, and you guys step in and tell me if you would explain this differently, as sort of being in charge of keeping things out of your brain and the fluid around your brain that you wouldn't want in there. And so if these particles are very, very small, I think what Dr. Allen's, explaining is that actually, even if this barrier can keep many other things out, these small particles can pass through. And to Allison's earlier point about how sensitive the prenatal period and the first few years of life are, these barriers aren't tight in fetal development, and not even when you're an infant. They're actually quite leakier than they are in all of us. And so it's just an additional time where you can get even greater sensitivity and potential crossing of some of these particles into, very, very young and still developing brains. So, Joe, you talked a little bit earlier about sort of these green products and asking for ingredient labels. And there was a question from the audience about how do you make sure that when you're looking at a product and vetting it, that you're actually choosing one that's safe for your indoor environment? And how do we advocate for increased transparency and labeling of these products so we know which ones to choose?
Yeah, I think this is a big problem for consumers. Even myself, I study this and it's really hard. And I think we really need systemic change here so that it doesn't have to be you're choosing a good one or a bad one without knowing. And I'll give you a quick example. Most people are familiar with seeing BPA-free baby bottles or cups, right? Well, it turns out when something's BPA-free, and BPA stands for bisphenol A, and it's a chemical we know that interferes with your hormone system. But most of the time when it says BPA free, it simply means that BPA has been swapped with its chemical cousin, BPS. I wrote about this in the Washington Post as regrettable substitution or chemical whack-a-mole. Hey, BPA gets a bad rap, we knock it out, and BPS is swapped in. And forever chemicals, same thing. There's a couple bad forever chemicals, but there's 15,000 different variants of forever chemicals. So as a consumer, it's nearly impossible to keep track of this. Dr. Lee hit on something important. We need to be sure that we have strong chemical regulation, which we have not had. Two, I think if you are in a position to influence purchasing at the institutional level, like Harvard, and we've partnered with Google and Salesforce and others, and we've diverted several $1 billion of capital spend to a healthier economy, such that when the average person buys a chair next time, they can buy one that doesn't have forever chemicals or doesn't have these pesticides or these plasticizers or doesn't have the flame retardant chemicals. But there's not really a label right now that a lot of people can just say, hey, I want the mattress that doesn't have forever chemicals. But I think it speaks to that, the policy level things that have to change. We need better federal policy, probably not going to happen right now. Let's be clear. At the same time, we can also try to influence purchasing decisions. That's why I think one of the best things people can do is simply ask manufacturers for the ingredient list. Tell us what's in your stuff, because then maybe we have a chance at saying, no, I've read about those forever chemicals. I don't want that one. But right now it's just not disclosed. So it speaks to a bigger problem.
Yeah, and actually a great actionable step that we can probably all take. Thank you so much to both of you. I learned a ton as always. This was a fantastic conversation, and we really appreciate everybody out there who took the time out of your very busy days and weeks and to spend time with us here today. So I'll turn it back over to Rebecca to close us out.
All right. Thank you, Lindsay. And thank you again to our panel for a really terrific conversation today. Before we close out, I just want to give everyone in the audience an opportunity to share feedback on this conversation. So on screen here, you can see a QR code to access our survey, and we're also pasting the link for the survey in the chat. And we really just welcome any thoughts or takeaways or questions that you have on everything that was covered and discussed today. Beyond that, please be sure to follow our social media channels and subscribe to our newsletter to receive information about additional webinars and resources from the Center on the Developing Child. And that link to sign up for our newsletter should be in the chat. And finally, I'll just say thank you again to you, our audience, for being here today. It was great to have you with us, and I hope you enjoy the rest of your day.